Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi, and today I'm going to be talking about macular degeneration. When patients come into the clinic, there are three things that they panic about. Number one, cataract. Number two, glaucoma. And number three, macular degeneration. What exactly is macular degeneration? Most of us, for us to better understand this, I'm going to use the analogy between the camera that we use for taking pictures and the eye. These two things are very similar in the way they work. First and foremost, your camera has two basic things: the focusing mechanism, which is made of the lens, and the back of the camera, which is the film where the image is focused on. You need both to function very well for you to have very good image. The same way with the eyes. The eye has a focusing mechanism made of mostly of the cornea and the lens. The lens is what gets cloudy, and we call it cataract. Then the lens in the eye focuses image on the retina. But it's not just the entire retina that it focuses image upon. It focuses image on a one very small pinpoint area in the entire retina, which is less than 1% of the size of the entire retina. And that one particular spot is what is called the macula. That is where detailed vision is processed. If there's a problem with the macula, you're going to lose detailed vision. So that means ability to recognize faces will be gone. You won't be able to read. You won't be able to drive. You won't be able to use your computer or watch TV. So anything that requires you to detailed vision will all be gone. And that is because that one spot, which is less than 1% of the size of the entire retina, is damaged. So that is why this thing called macular degeneration is very important. The whole retina can be damaged, and if the macula is okay, your vision will still be good. You probably will not notice that there's a problem with your vision if the macula is okay and the other part of the retina is damaged. You won't notice. The eye, we said, has two major parts. The focusing mechanism, which is the lens. The lens gets cloudy, is called cataract. It focuses its image on the macula for us to have very good vision. If the macula is damaged, of course, vision is also going to be down. Then these two things work together, the lens and the macula on the retina. Now, if whatever image is formed at that macular level needs to be transported to the brain for the brain to interpret whatever image you've seen. Whatever the connection between the macula and the brain is the nerve. That nerve is what is damaged in what we call glaucoma. So these three things, cataract, macular degeneration, and glaucoma that we are all afraid of, goes through one pathway. If you have cataract, you may not notice it, so long as the macula is good and the nerves are good. You can have cataract and not know, because you'll still be able to see at the early stages. You can have glaucoma and not know, because you will still be able to see. Glaucoma affects the peripheral vision. But if you have macular degeneration affects the central vision. So you will know immediately, because your vision will start to deteriorate. And that's why macular degeneration is very, is a topic that we should understand how it works. So who are the people that are prone to this age-related macular degeneration? As the name suggests, it says age-related macular degeneration. That means aging is a predominant factor. So you cannot find age-related macular degeneration in a patient that is 5 or 10 years old. Most times 50 and above is when you start becoming prone to macular, this thing called age-related macular degeneration. So if you are very light-skinned or very light-colored eyes, that's the iris, you are also highly prone to develop macular degeneration or age-related macular as you age. And that is why it is very common in the Caucasians compared to black people. Of course, black people have their own. Black people also are more prone to glaucoma compared to the white people. So we all have our own. Now, another thing that predisposes you to macular degeneration is smoking. It doesn't really matter if you are the main smoker or you're a secondhand smoker. So if you are in a room where people smoke and they've been smoking for a long time, you're also prone to macular degeneration. Smoking puts you at 2 to 4 times the risk of developing macular degeneration, especially if you have a family history of macular degeneration. So it's very important to know that smoking is one of those things that you can cut down on or avoid completely if you don't want to develop macular degeneration, if you are prone to it. Then another thing that can cause macular degeneration is UV from the sun. So for most people that spend time outdoors, it's highly advisable to always wear UV protection sunglasses. Also, if you spend a lot of time in front of your digital devices like computers, tablets, and the others, you're also exposing yourself. In that case, make sure that your glasses have the blue blocker filter on it. Before now, people used to have the screen or have it on their computer screen. But these days, because we use tablets and all that, you cannot be putting it on every screen. So it's better to have the blue blocker, that's the filter, on your lens itself. So that way it also protects the eye. Then another thing that can cause macular degeneration is our eating habits. For most of us, as we get older, there are free radicals that actually damage this macula. We need to have antioxidants in our food. It can be through natural sources like the green vegetables, the green leafy vegetables. Here we're talking about things like kale, broccoli, or spinach. Or alternatively, we can use the omega-3 fatty acid sources, are also very good. Here you have fish, you have cod liver oil, very good. Then we also have the supplements for those that cannot get those antioxidants or the nutrients that we'll talk about from the natural sources. But remember, there are two types. If you go over the counter, the most common one is the one that's called Vitalus. There's Vitalus for healthy eye. There's Vitalus for macular degeneration. If you are not diagnosed with macular degeneration, you can take the one for healthy eyes to prevent getting macular degeneration. But if you diagnose with macular degeneration, you cannot be taking the one for healthy eyes. You have to take the one that's for macular degeneration. So a lot of time patients come in and they kind of miss the two, or they don't even know there's a difference between them. So there's Vitalus for healthy eyes and there's Vitalus for macular degeneration. But both of them contain lutein and zeaxanthin, which you will also find in those natural sources that I mentioned earlier. Broccoli, kale, spinach, or the omega-3 fatty acids sources. So another thing that we strongly encourage is an active lifestyle. An active lifestyle. Exercise. Even if it's walking for 20 minutes, 3 rounds a day, makes a big difference. This will help to minimize things like high blood pressure, because the retina, which is the back of the eye, has very thin blood vessels and they're very fragile. Things like blood pressure can easily damage those blood vessels. So if you have macular degeneration and you have high blood pressure, the chances of that macular degeneration, the dry one, which is the beginning stage, progressing to the wet one, which is the very bad one, the chances increases if you have things like high blood pressure. The difference between the dry macular degeneration and the wet one is in the dry one, you don't have bleeding vessels around it yet. The wet one means you have macular degeneration, but you have bleeding vessels around it. At that point, your only option is have visits to the ophthalmologist from time to time for laser vision procedures. And those laser vision procedures are extremely expensive. They're extremely expensive. So, and it's not guaranteed that you're going to get your vision back. The best is to make sure that your vision does not deteriorate more than that stage. Macular degeneration will end up with low vision. Low vision is a mini form of legal blindness. When you have low vision, there are so many jobs that you cannot do. Moving around is a problem. So picture it as a mini form of legal blindness. And that is why macular degeneration is very important for us to know what it is and things that we can do to prevent us from developing it as we get older, and also to help us, if we develop macular degeneration, from progressing from the dry one to the wet one. So I just thought I would share these tips with you guys. It's better to know. But even if you already know, still share the video. You may be saving somebody else that's not aware. So if you think you learned one or two things from the video, leave a comment for me in the comment section. Also, if there are topics that you want us to talk about, leave it in the comment section. I will address it. So thank you, ladies and gentlemen. I'll see you guys at the next video. Thank you.